in putting more money into our health services, but creating another bureaucratic layer is only going to make it more difficult in a situation of life and death. When you're taking a patient to hospital, a dear one, a loved person, you want he or her to get the best treatment that they can get. And because the public health facilities cannot cope with it, this is why we have a lot of private practices in this country. And to a certain extent in Kenya, because of misguided policies, almost all the good health services have been privatized. Ordinary poor people, rural people, the urban poor, cannot access health facilities. They cannot afford the cost of private medicine. And I think maybe this amendment discussion here in the House also provides us with an opportunity to rethink what kind of health services we want. Even the most advanced countries in the world have public health services that are affordable, in fact free in some situations. The British National Health Service, all the European unions have a heavily subsidized public services of good quality. And we're in a developing country with a large number of very poor people. And if we cannot improve and finance and improve our health services, then many, many poor people are likely to die of diseases that can be prevented or cured. And that's why I think this amendment should jolt our minds to make sure that, in fact, we go and look at alternative ways other than regulating. You know, some of the problems that are raised by it can be cured through internal mechanism. You know, our Kenyan medical services have professionals. They have professional institutions. The practices at the universities, medical practices at the universities and medical centers can incorporate stronger ethical practices that can overcome some of the problems that we create. We have realized in bringing this particular amendment to this House. So I think, to a certain extent, this amendment is trying to overcome many of our national problems, and I think that is just purely firefighting. It cannot resolve the bigger problem, the mindset, the culture, and everything related to it. But the bottom line is that in Kenya, our infrastructure is not good enough, our medical services are not good enough, our health services are not financed enough. We have serious shortage of professionals, and many of our good professionals, because of poor wages, are opting to go outside the country. You see, our nurses have been recruited in foreign countries, our doctors are going to foreign countries. What we need is to give them good terms of references and good salaries so that they can stay in this country and provide the services that are required. Therefore, Mr. Speaker, I do oppose this amendment and support the decision of the Health Committee. Thank you.